Hello, hello, hello. We are going to chapter 10, Cost of Health Services. So, the learning objectives are identify factors leading to higher health cost, describe the impact of higher health cost on insurance premiums, Medicare, Medicaid, and personal bankruptcies. Then access the relationship among health costs, access, and quality. Describe government methods for controlling healthcare costs. Few Americans can afford expensive treatments and procedures without some form of coverage. Healthcare has only been a top priority only once in early 1990s, and during serious illnesses like heart attacks, patients and families prioritize treatment over costs. The third-party payer health insurance system is a key factor for driving up healthcare costs. With this system, consumers don't pay the full price of services when received, leading to increased healthcare spending, surpassing the general price inflation for decades. As healthcare services consumed rise, total expenditures increase involving various inputs. These inputs include labor, non-labor. Total expenditures depend on both, influenced by the patient population served. That is, labor is the physicians and nurses, and non-labor is hospital beds and facilities. Gross domestic product represents the total value of goods and services produced in the US. Healthcare spending constitutes a considerable share of GDP. By 2016, it's projected to increase to 19.6 from 17.3 in 2009. Fluctuations in healthcare spending significantly affect the national economy. Healthcare costs can be direct or indirect. Indirect costs involves lost productivity or income during illness, recovery, or premature death. Indirect costs often exceed direct costs for most diseases. Illnesses lead to income loss, such as sick individuals may not work, pay fewer taxes, lose health insurance. Costs include physician visits, prescriptions, or hospital stays. Heart disease has a smaller indirect cost due to productivity loss from older individuals, while accidents have higher indirect costs, especially for younger individuals in their peak earning years. So, healthcare cost overview. Healthcare as a percentage of GDP and per capita health expenditures are higher in the United States than in other countries. Primary drivers of healthcare spending include cost of physician and hospital services, intense use of medical technology, and end of life health services and medical research. Healthcare as a percentage of GDP and per capita income are higher in the United States compared to other developed countries. US healthcare spending per capita is more than double that of any other developed countries and is increasing faster than general inflation. US healthcare spending grew 4.1% to reach $4.5 trillion in 2022. This is the latest figures that is not given in that slide. I took the reference is given there. So this is figures as of December 13, 2023. Faster than the increase of 3.2% in 2021, much slower than the rate of 10.6% in 2020. So basically, US healthcare spending is that 2019 expected was 13.438, and now it is 2022 it is 4.5 trillion, and that's the difference which we are looking at. Again, this is not the exact figure what is given in the slides, because this figure is taken from internet. Thank you. Compared with other healthcare high-income members for Organization for Economic Cooperation and Development, the United States have much higher annual growth in healthcare spending. 4 factors explain the growth disparity between the United States and other OECD countries: aging population, robust economic expansion, rapid technological advancement in healthcare, and expanded insurance coverage. Rising healthcare costs are a bigger worry than increases in other expenses like cars, houses, computers, leisure activities, and entertainment. Normally, higher consumption of these goods signals a strong economy. Now the question is, will healthcare crowd out other items, demolishing the US standard of living? As healthcare costs rise, affording health insurance becomes harder. Access to healthcare directly affects health, similar to food and shelter. Limited access due to lack of insurance impacts the health of uninsured individuals. Figure above is a breakdown of the skipped or delayed healthcare services due to lack of insurance. Healthcare quality is vital for good health outcomes and demands substantial investment for upkeep and enhancement. Cost reduction strategies like care rationing may harm quality. Reimbursement changes from containment strategies like prospective payment systems and diagnosis-related groups can also impact quality. The federal government is a major healthcare consumer and financier, contributing about 47% to healthcare expenditures. Healthcare costs have risen faster than any other commodity. Currently, government borrows 40 cents of every dollar it spends, leading to consequences like reduced ability to offer new services, impacting areas like national defense and education. Higher deficits could lead to increased taxes as more of the federal or state budgets go towards repaying government debt. Tax hikes may be necessary to maintain current levels of government services, potentially slowing economic growth. Studies show that much of the rise in healthcare spending occurs in the last months of life, aiming to prolong life. Spending is notably higher in the last 2 months of a person's life than the rest of the year. Heroic measures like operating on extremely premature babies or very sick elderly are attempted despite uncertain outcomes. Clinicians resort to such measures due to unpredictability of a patient's death. During World War II, the United States started subsidizing private health insurance by making employer-sponsored health insurance a non-taxable fringe benefit for the employment. Since then, health insurance as a benefit has become a significant cost to the business. To cope up with the rising healthcare costs, employees often sacrifice pay raises and face higher deductibles to keep their health benefits. Over the past decades, adjusting for inflation, wages rose by only 1%, while employer health benefit costs surged by 163%. So the cost of employer-sponsored insurance affects international trade too. The cost of employer-paid health insurance for employees and retirees is passed on to consumers as a cost of production for many goods and services. US competes in the global economy with nations whose employees don't have to pay for health insurance. So rising costs, healthcare costs impair the ability of the US businesses to compete internationally. Employers employ strategies to reduce their healthcare cost burden by shifting employers into managed care plans like preferred provider organizations, point of service plans, and health maintenance organizations. The figure above illustrates the shift from enrollment in traditional indemnity plans to managed care plans among the covered workers. Secondly, employers streamline their health insurance providers to consolidate purchasing power and gain maximum advantage. Thirdly, employers shift more healthcare costs to employees, requiring them to cover a higher portion of the insurance premiums and increasing deductibles, co-payments, and co-insurance. Look at the figure above. That is a graphical representation of the rise in average workers' contribution to their family health insurance coverage. It has been growing. Rising health insurance premiums, even with the employer-sponsored plans, force some employees to choose between insurance and essential expenses. Low-wage earners may forego employer insurance, leading to uninsured status. Out-of-pocket expenses can become burdensome for the uninsured, covering prescription medications and treatment. Employers often increase the employee healthcare costs to contain expenses and offer incentives for prudent healthcare choices. Limited options for higher quality or member-centered plans contribute to employee dissatisfaction, impacting public perception of managed care. The United States is increasingly litigious, with trial lawyers earning high incomes by suing physicians and hospitals for malpractice or negligence. Medical malpractice involves improper treatment by healthcare providers. Clinicians, especially OB/GYN, that is obstetric gynecology, orthopedics, and neurosurgery, often obtain malpractice insurance to safeguard their assets from litigation. The rise in medical malpractice suits stems from various factors. Patients often see multiple providers without a primary care clinician to coordinate their care, leading to fragmented communication. Increased specialization among physicians exacerbate this issue, and rapidly forming clinician-patient relationships lack the trust needed to prevent miscommunications. Patients' trust in the healthcare professions has diminished, and lawyers offering few only when successful arrangements incentivize lawsuits. As medical procedures grow more intricate, the likelihood of mistakes causing harm rises, prompting more legal action. Policymakers propose various solutions to the malpractice cost. Some suggest total reform, while others advocate for reducing or eliminating contingency fees for lawyers. The contingency system encourages malpractice claims by allowing individuals without upfront fees to retain lawyers who then receive a portion of the successful lawsuit awards. Other suggestions include sanctions for frivolous suits, no-fault insurance, and shorter statutes of limitation. A proper proposal is 250,000 cap on pain and suffering awards, which wouldn't prevent compensation for healthcare bills, lost wages, and future treatments. Mandatory arbitration has also been suggested. Ultimately, enhancing quality control remains the most effective strategy to reduce malpractice claims. Healthcare utilization and costs are unevenly distributed across populations. On average, one critically ill person out of every 50 accounts for 33% of all expenditures. Additionally, many patients request and utilize unnecessary healthcare services. Variations in healthcare practices exist between states, and the service often influenced by the geographical location rather than the medical necessity. Debates amongst researchers and policymakers revolve around whether patients are receiving appropriate levels of care based on the availability of the hospital beds. Studies indicate that increased hospital bed capacity leads to more admissions, a phenomenon known as Romer's law. This suggests more beds results in more patients admitted, potentially influenced by the physician's induced demand. Sources of variation in healthcare expenditures include scientific uncertainty, substitutability among interventions, illness patterns, clinician practice styles, all of which differ from actual care needs. Improved technology and perceived effectiveness in healthcare contribute to increased demand. Two primary types of healthcare price inflation are demand pull inflation and cost push inflation. Demand pull inflation occurs when consumers' willingness to purchase exceeds the available supply, often facilitated by health insurance. Factors contributing to the demand pull inflation include aging populations, higher incomes, overuse of services, population growth, and heightened expectations for care. Cost push inflation arises from increased production costs for service providers. This inflation may result from the factors such as new technology, rising wages, service duplication, unionization, defensive medicine practices, and inefficient service utilization by inexperienced providers. Experts use Consumer Price Index (CPI) to measure inflation, which tracks changes in cost of living. The CPI reflects the purchasing power of the dollar and calculated monthly based on the average price changes for a fixed market basket of about 400 goods and services typically purchased by urban consumers. Healthcare is one of the major groups in the CPI, providing insights into trends in healthcare prices, including hospital, dental, and drug costs. Items in the CPI are weighted according to the percentage of income spent on each, with a selected base year for reference. CPI isn't the ideal method for measuring healthcare inflation because it doesn't consider quality changes, excludes new items like certain prescription drugs, and may include outdated ones. Manufacturers usually don't raise prices for outdated products. Also, as hospital stays are shortened, more services are packed into shorter periods, raising costs. Changes in amenities aren't accounted either. Over the past 25 years, the CPI for healthcare has increasingly exceeded other consumer price movements. The recent decline in healthcare inflation over the past decade mirrors an overall decrease in inflation. Hospital services and prices have historically seen higher inflation rates compared to other healthcare items. Third-party payers have spearheaded to cost control efforts in healthcare, targeting hospital payments, inputs, delivery systems, and utilization. However, these strategies have largely failed due to factors like population aging and technological advancement driving cost increases. Attempts to address these issues have targeted aspects like consumer behavior and insurance industry fragmentation. Enrollment in managed healthcare organizations aim to curb costs, but excess hospital capacity and varying price practice standard persist. Clinical guidelines and care protocols are being utilized or used to standardize practices and reduce costs, while initiatives promoting patient-centered care and clinical outcomes aim to improve quality and efficiency. Rising healthcare costs impact both healthcare industry and the broader US economy. The third-party payers and the rapid expansion of high-cost healthcare technology are the key drivers of this trend. Uncontrolled cost increases affects health care access, quality, and contribute to national deficit and federal growth. The factors like resource-intensive and end-of-the-life care, that is, we have read the past that, or we have learned the past that towards the end, the cost is higher. So that the malpractice lawsuits and defective medicine also drives the costs up. This fragmented insurance industry exacerbates this issue, leading to increased expenses. Managed care organizations attempt to curb costs by challenges persist due to excess hospital capacity, outpatient procedures growth, and practice pattern variations. Efforts to address these issues include implementing clinical guidelines and care protocols. When it comes to saving lives and concerns about malpractice, it's worth noting that as far back as 1932, the final report on the committee and the cost of medical care expressed similar worries about cost, access, and quality. Some might argue that we haven't made much progress since then. So basically what we are saying is that this has a lot of issues. The healthcare has a lot of issues that needs to be fixed. It has been there for a long time. And steps are being taken slowly but steadily. We have to curb the cost and also move towards more prevention of the diseases. Having said that, you need to read the textbook. Again, this is just important content from the textbook. Happy reading the textbook, and most importantly, keep smiling. This is Dr. V signing off. Thank you.